3 cases have been confirmed, while 15 suspects are admitted at the Isolation Treatment Center at Kagadi Government Hospital. 40 others who came into contact with the suspected cases are being monitored for the next 21 days. The Ministry of Health attributes the increase to the quick response to the suspected alerts. However, as the medical team fight to contain the disease, they are being overwhelmed by numbers.
One of the challenges we are having is the shortage of staff for the Isolation Treatment Center and issues to do with the feeding of the patients.
The Ebola strain in Chibale is particularly difficult to deal with because it does not have any hemorrhagic tendencies.
And I can tell you that of the cases which have presented so far, there has been no evidence of the hemorrhagic aspects of Ebola. And therefore, it's what we call a confounding factor. It presents in a manner which mimics other diseases.
Yesterday we had a meeting with all the in-charges of health units. So most of the health workers in the districts came and we were oriented about the clinical criteria about Ebola, preparedness and preventive management, triage and referral of the necessary of these patients who are supposed to be transferred to the isolation center at Kagadi Hospital.
16 samples collected since the outbreak are currently under investigations at the Uganda Virus Research Institute. The Ministry of Health urges calm and says the death toll since the outbreak, which was confirmed on July 28th, remains at 14. Meanwhile, 8 health workers at Mulago National Referral Hospital are being monitored. Ebola is very infectious and kills in a short time, but it can also be easily prevented. Its signs and symptoms include fever, vomiting, diarrhea, abdominal pain, headache, measles-like rash, red eyes, and sometimes with bleeding from body openings. Irene Namialo, NTV.